Last November, we told you about therapists, chiropractors, social workers, even doctors in some of Maine's largest hospital systems not being paid by Anthem, Blue Cross, and Blue Shield.
The delays were blamed on switching to a different billing system and hiring shortages. But now, several months later, a number of Anthem providers claim they are still missing thousands of dollars in payments, and those delays are putting the care of patients in jeopardy. News Center Maine's Vivian Lee has our follow-up.
Caroline Fontaine is the executive director of the Maine Optometric Association, which represents more than 200 optometrists throughout the state. She says a third say their claims are being delayed or rejected by Anthem, Blue Cross, and Blue Shield.
It is either slow pay or no pay, or they're not in network. The coding is wrong. Right. They put the wrong prefix in for coding.
Fontaine disputes that, claiming the billing codes are correct and have been used to process payments for years. She also says Anthem is demanding refunds for overpayments for services.
They are pulling claims 6 to 8 months back and saying that they won't pay them. They're taking the money back.
Gwen Simmons is a physical therapist and attorney. She is also the past president of the Maine chapter of the American Physical Therapy Association. She has heard from a number of PTs missing payments for being, quote, out of network despite being contracted Anthem providers. Others have had payments delayed for weeks.
Several clinics were paid with debit cards that then got declined because there were insufficient funds on the debit cards that Anthem paid their services with. I don't know how that happens.
Billing issues persist despite steps being taken by Anthem to rectify issues that came to a head last fall. At that time, Anthem told providers the delays were the result of switching to a new provider management system, which did not recognize billing identification numbers. A phone line and a care provider assistance team is now available to help process claims. In a statement, Stephanie DuBois, Anthem's director of communications, tells News Center, "We have heard from many care provider partners across Maine who have thanked us for creating a dedicated team to work directly with them to resolve any issues they may have. We're proud of our progress, but we recognize that there is still work to be done. We encourage any provider who needs assistance to call our team dedicated to meeting the needs of Maine providers." Dr. Jeffrey Barkin is the president of the Maine Medical Association. It represents about 3,000 providers across the state. Recently, he met with Anthem officials after hearing from members who say claims are being processed faster but are still delayed.
Now, Dr. Barkin tells me Anthem officials told him they are willing to continue meeting, possibly on a quarterly basis, as part of a payer-provider committee that can come together to address ongoing issues.
So that should problems occur, downcoding, denial of claims, and other sorts of behavior that threaten the health of Mainers, it's our hope that this committee will identify and prevent that.
But some providers say if payment problems continue, Anthem customers could face less access.
The PTs are fed up with these issues, with the problems, and they're starting cash practices
to medical treatment and services they need. Vivian Lee, News Center, Maine.
A spokeswoman for Northern Light Health says there continue to be delays for in-state claims and no improvement in processing out-of-state claims. Maine health officials tell us that while there has been some progress in processing unpaid claims, denials and delays continue for payments for routine care. We have much more information on our website and our mobile app.